as well. As I mentioned to you, he got a very versatile personality. You can see him for president. You can see him within, Phoenix with Milad as well. And let me welcome and khush amdeed to Dr. Akhtar. Assalamu alaikum, Dr. Akhtar.
Walaikum salam. Thank you very much for kind introduction. And I'm so pleased to be here, Range Hayat program. Life without the health, good health.
Without the good health, definitely. Doctor, this topic actually came into my mind because, as you know, that I'm a beautician. People come to me, old, young, all the people. And few ladies were asking me some questions. So I said, why not make, like a program which the people who are listening, as we know that Al-Ansar giving it's a very good information program as well, informative. So this point has come to my mind that we should know how to use our medication and supplements together, and what are the right timings, what are the right ways to use. Now, people have chronic diseases like sugar, pressure, or sometimes they diagnose with antibiotics they are taking, so all these like hypertension, thyroid, people are taking regular tablets for all these different kinds. And then plus they have to use supplements. Sometimes it's herbal, natural, or other chemical supplements as well. They are using iron tablets, calcium, they can use multivitamin, they are using different kind of thing. So what you suggest and how we can make our life easy, or it will benefit us the best?
Thank you so much for this very important question. You mentioned chronic disease. So I like to just break it down. Chronic disease is a non-communicable disease, and there's a communicable disease. Communicable disease means infection. So we are not talking about infection because we just came out after long COVID infection. Apart from COVID infection, we have HIV, TB in the community. That we'll discuss some other day.
Okay.
But now the most important point you raise, that is the chronic disease. Chronic disease in a medical terms, we say non-communicable disease. And it's very, very difficult to treat, number one. Number two, any chronic disease, we need a proper diagnosis. Without diagnosis, we cannot use some of the medication used lifelong, like hypertension, sugar, diabetes, you mentioned, kidney problem, thyroid problem. So most of the chronic disease medication depend on the diagnosis and the dose. So most of the disease, like high blood pressure, I will use hypertension or high blood pressure. It's a medication work for 24 hours. It's always better to take this chronic medication in the morning after breakfast.
Okay, for the high blood pressure.
High blood pressure.
So it's very nice in the morning.
It's nice because we don't want anybody miss, because you're taking everyday chronic medication, it's become a routine, but it also sometimes you forget. Because this high blood pressure, without treatment, it will come back again high. So you need to put 24-hour medication every morning, so whole day, whole night you remain peaceful.
Okay.
You're healthy.
Okay, before breakfast or after?
After breakfast.
After breakfast. Okay. So this is so nice. You're talking about the timings of the chronic disease of high pressure after breakfast every morning. Okay. So, now another one.
And also there's a good practice. You must have a chart. You tick it. You take the medication, you take your blood pressure before medication, after medication. So your adherence, your compliance, you are doing fine, your blood pressure is prevented, control. The moment you control your blood pressure, you are saving your chronic complication for your life to live healthy, because if blood pressure is not controlled, you will have a stroke, you have a heart failure, kidney failure, so many other problems. So once you take regularly your medication and writing down your blood pressure and tablet, tick, and after 1 month when you're visiting your doctors or clinic, it's become so easy. Look, I'm on chronic medication. This is my report for the whole 30 days or
30 years.
2 months or 3 months or 6 months. And very important, if you are on a chronic medication, you have a full proper checkup every 6 months, all once a year. And you must have a full eye checkup, heart checkup, food checkup, and that's how it works. And once you are adherence and your compliance very well with the high blood pressure control, please follow natural things. What are the natural things?
Yeah.
Exercise, brisk walking, relaxation, stay away from stress. Those are the things you can under control yourself. You don't have to worry about anything, and stay away with the
Healthy food as well.
yeah, the healthy food. Mainly you need to avoid oily product food, red meat, that also cause a problem, cholesterol, things like that. So if you taking diabetic medication, that is bit depend on diabetic on tablet or insulin.
Insulin, yeah.
So if you're taking insulin or diabetic, you need to know where to keep the insulin, what temperature need to be there, how much insulin need to be taken. Sometime, our elder patient can't read, can't see, you need a glasses. So you make sure somebody help you. And now it's simple. It's a pen type of injection. You just have a 1 click, 2 click, 3 click, 3 unit, 4 units, and you take it after the breakfast or before, whatever
Doctors
say.
suggested. Yeah.
And if you got a vitamin deficiency, especially now in a market, in the pharmacy, everybody is selling alternative medicine.
I'm telling you, this vitamin and all this.
Even they say you take this vitamin, this medicine for joint pain, and your arthritis will disappear, your sugar will be disappear. Some people are saying you do this type of medication or follow this, your sugar will disappear. So once is diagnosed, medication scientifically research proven that you must continue with it. Nothing going to be disappear. It will be reappear the moment you leave the medication. So the alternative medicine, yes, it help, it boost you, you give extra energy, but nature has given us enough supplement, like sun. From the sun, people are sunbathing or sitting on the sun, they give you vitamin D. You don't need to take much tablet. Like if you are
But nowadays, doctor, if you ask me, a lot of people, even myself, are vitamin D deficient, and then we are taking supplements. So can you explain it to us that what are the good timings for multivitamin and the vitamin D, is it clash with the chronic tablets?
Not really.
Okay.
Not really. Multivitamin, you can choose timing anytime you can take. There are no interaction with the drug. You see, the interaction means
that's I understand
that chemical ingredient destroyed by another medication.
Yes.
So these are the multivitamin or vitamin D or iron tablet. They got own problem, but it don't interfere any medication.
Okay.
So it's fine. So I won't say you must take all the medicine one time. It's too much.
Okay.
It's like a small breakfast. Some people take 10, 20 tablets.
Yes.
So you can divide it. Some you take breakfast time, some you can take lunch time.
Okay.
So the multivitamin and all is not going to cure any disease.
Yes.
Yes, it will help your immune boosting type of things.
Okay.
But if you can do the exercise, take the sun bath, or sit with the loose cloth with the sun, expose your body in the house with the sun, with the family, or when you are alone, because we wear, our clothing are so much that there no way sun can penetrate in the body
as well,
and that's why we need that sun exposure. And it's a through the skin vitamin D metabolize and synthesis is go to the liver, kidney, and
Uh-huh.
go to the
Okay, so
bone.
multivitamin you can take either morning, evening, and in the night as well,
No,
doctor?
multivitamin you must take once a day,
Yeah,
anytime you like.
in the night too.
Yeah, at night you can only
It
take.
doesn't make any difference before
No,
food, after food, nothing. So
no.
multivitamin
You
anytime.
see, after taking food is better after half an hour or 15 minutes,
Hmm.
because empty stomach
Hmm.
you take medication,
Hmm.
except vomiting medicine.
Hmm.
We say some people are vomiting, we give some medicine to stop food to be come out
Yeah.
vomiting. So we give like Maxilon and tablet antiemetic
Hmm.
that can help you to stop vomiting.
Hmm.
So whatever you eat, it retain in the body.
Otherwise, most of the thing after food,
Yeah.
after 15 minutes or half an hour.
Better is to take half an hour. So
After
let
half
the
an
stomach get slightly empty,
hour.
so you absorb better.
Okay.
If you take empty stomach, some of the medicine like aspirin and Panadol, some other medication, or joint pain medication, they irritate the
Bone,
mucous membrane of the stomach,
stomach. Yeah.
and that can cause ulcer. So we don't want to cause complication just because I'm taking medication
Hmm.
untimely or wrongly. So it's better to make sure when the stomach is had a food inside and with the water. Some people worried, how I must take this medication.
Hmm.
Should I take with the milk? Should I
Yeah,
take with
I'm
the
coming to
coke?
that point. Now you are telling that any tablets try beside recommended by doctors, physicians, or your own personal specialist. Beside that, try to have your medication after half an hour of your food, so it'll be better. And if you have a lot of medication like 6 tablets or more than that, don't take all the tablets at one. You have to give space in
Yes.
between, and that's how you can take as well. Now the question arises that some of I remember in olden days as well, they say must have with milk,
Yes.
must have with this. And what about with the fizzy drink and soft drink people take? So can you explain all those things, doctor?
Yes. You see, the water is the purest form of the
Liquid, any kind
liquid,
of
and it's
liquid.
a H2O. It's
Yeah.
a hydrogen and water.
Yeah.
So if you're taking with the fizzy drink, Coke, or any other Red Bull or milk, they need to absorb themselves. Water is a clear. It go and with the medication absorb.
Hmm.
So the absorption of the tablet or medicine or syrup need to be natural.
Hmm.
So the water is the best way to take.
Okay, for
And some
anything,
people
for
also
all the
say
things.
hot water or cold water.
Yeah.
It's better to take normal water.
Normal water. Okay, so understand that we have so many things. We understand that we have questions, and we know I saw people after food they just take one sip of cold drink and they're having their tablets, whether the sugar tablets or whether pressure tablets. So better to take all the medicines with water. Room temperature will be fine, but it's thick. As we said, again I'm repeating, then if you have lots of medication, please make space between having all the tablets as well. Don't just take all your medication at once. Try
Yes.
to give space. Plus the pressure and the sugar tablets, make a routine that in the morning you are taking, and you are then you know that the whole day you can run. I think I have one. Brother Ted, can you please tell me that as well? Ted, we have a WhatsApp now, please. Salams, please repeat what tablet must take to for vomiting. Jazakallah khair. For vomiting, you mentioned something. Whatever your doctor suggests, you can take, but Dr. Akhtar can,
Okay.
because he's here, so he can tell as well.
No, the vomiting medication depend on what type of vomiting. Is a simple vomiting or just some other pathology, like sometime a child or adult can vomit with the intestinal obstruction. In this case, if you take vomiting medicine, antiemetic, it's not going to work. It will cause more problem. So like gastroenteritis or diarrhea vomiting, that in that scenario, if you're taking to stop the vomiting, you can take antiemetic like Maxalone type of things. But better to have a checkup before you take. Don't just take from the counter and anti-vomiting tablet, antiemetic, because it could be an intestinal obstruction or it could be some other pathology which can cause more problem. So always need to be checked and take.
Okay, so many things we already know from Dr. Akhtar's, knowledge, whatever he is giving it to us. That for the high pressure, blood pressure, we have to know. For the our sugar, we have to know that we have to make a chart. And we have to take this responsibility on ourselves that every morning we take our pressure and sugar and write whatever is there, and we taking our tablets. And actually I remember that it really works for people, and it they with the chronic medication they become very light, the sugar comes right and the pressure comes right, and the dose comes always very low as well, doctor. And then he said that we have to take the timings are very important. We cannot just pop in all the medication at once. We have to take some time after food too. After half an hour of the food, we can use those tablets plus multivitamin, and whatever we are taking after the food we can take. We can take not with water, not with milk or fizzy drink. Water is the best. And what kind of water? Room temperature water. Ji, doctor.
Yeah. You see, some of the medication like antibiotics, we do get antibiotic. Some antibiotic, we give one tablet for a day. And because it got a potential to cover your body serum activity for 24 hours. Some of them we give for 8 hourly. 8 hour means if I give 4 tablet, 8 hour, it covers the 24 hour to kill the bacteria or germs. Same thing, some of the medication, they got potential for 12 hours. So when 12 hours finish, we need to start another dose. So it give you 24-hour coverage. Some of the medication we have like 6 hourly. So that is because of the nature of the diagnosis, nature of the etiology of the germs. So we complete. And chronic medication, as I said, it run for the body serum for 24 hours. After that, it is excreted out from the body and the urine. So you need to take every day once.
Okay, doctor, 2 questions I have for you.
Yes.
Number 1 is the painkillers, which we take as Smarties, as bubble gums, as any sweet, I'm telling you, because I've seen people, right? Secondly, I wanted to ask you, what we have to say that water intake supposed to be more than normal when we are taking antibiotics or other tablets, and the painkillers, what you say the painkillers and how it works with that as well.
Well, painkiller is needed when indication is there. If I take painkiller, just like you said, toffee or chocolate,
Yes.
just for headache, we take a strong painkiller or something. All the painkillers is not the same. I remember people in the those haven't got enough access to the medical or the going to the clinic, say grandpa. Grandpa is just a cosmetic type of medication. It helps. But we must remember, like paracetamol, Panadol, other painkiller, every tablet got an effect on the body. It do relieve you pain, but the excessive painkiller can damage the kidney, also can damage the liver. Even the aspirin, Disprin, codeine, all this simple medication, if I take excessive, in a long term, my liver can get damaged, liver failure can happen, kidney can get damaged, kidney function can be abnormal. So if you don't need, if you manage your pain somehow, please stick around with the prescription. Don't overuse over-the-counter medication. In a long run, it can give you complication of your kidney and liver, stomach, even can get an ulcer and gastritis, peptic ulcer.
Okay, doctor, one question again, that what can I take for energy? I am 70 years old and I'm diabetic.
Well, number one, diabetes patient need to control sugar very well. If you have a tight control your sugar within the normal range, and your 3 month or six month assessment of sugar HbA1c within normal range, your energy level will be fine. What happened? We
She said,
have
I'm diabetic from 30 years.
diabetic patients are now living more than 40, 50 years. Diabetic is
It's not a killer.
now diabetes is well controlled with the diet, with the medication, exercise,
Shukr, alhamdulillah.
and stress-free life. 70, you are going to do very well if you keep control your diet, do some exercise, you will get your energy back. Okay, of course, you will take some supplement like multivitamin, depend on what vitamin. Some of the vitamins are not halal. Make sure you take a halal multivitamin because those are the imported one. They got gelatin type. But I'm not going on that.
Yeah, we're not promoting.
My advice, any diabetic patient, please walk around, take some exercise. Don't just sit and watch your TV or just sit whole day
with the cell phone.
and and drinking any fizzy drinks. Just please avoid. Even you can stand whole day is better than the sitting in a diabetic patient. If you got a joint problem or walking problem, just stand around. Just if you can't walk, even you can walk few steps, you do it. Even you can go up and down, do it. If you can't go outside and do exercise, still keep standing. Maximum time you utilize your standing position than the sitting position.
That's very nice.
Your metabolism must burn. Carbohydrate must burn from the body. But there's thousands food to eat which has got no sugar. So follow that route, your energy will be back. And have a positive mindset that I will beat diabetic by diets and exercise.
We have another WhatsApp for doctor here. Like, doctor, what's the best pills for arthritis? We are not here to give any kind of suggestion. Yes, but doctor can talk about arthritis.
Arthritis, you see, there are different type of multiple type of arthritis. Big joints swelling, big joint pain, age-dependent big joints like knee joint, hip joints, ankle, then gouts, then single joints. So it depends what type of arthritis someone have. So the best treatment is a non-steroidal anti-inflammatory we call, which has got no steroid, no cortisone, which is not going to cause another damage to the body. So simple painkiller who relieve the pain. There are some new drugs are there, but not from the cosmetic side. I'm talking the real prescription doctor, orthopedic or the arthritis doctors are prescribing now. But simple, keep it simple. Again, I will say your mobility, even you got arthritis, your mobility is important. Your physio, muscle strength must important.
Our one listener, Sarah Bibi, Mustafa told that because how doctor said that. So they say, salams to one and all, not only sleep, but must do some work. So this is the time for us to close our program. Such an informative program from Dr. Akhtar. And the timings, actually, we have very less time to encompasses the whole thing of this thing. But doctor, thank you so much for giving such a great information about that as well, that we have to be active. Even if we can't walk, we can't run, we just stand and walk around is more than enough for us too as well. So whoever is listening, for arthritis, for sugar, for high blood pressure, please start working and eat
and
healthy.
Reduce the weight as well.
And reduce the weight as well. This is the biggest concern at the moment for us to reduce weight, because I don't know why the weight consumption was like too much now, because of COVID, or I don't know,
we're not having enough exercise. We don't walk around. We are very comfortable in a whole day, from the house from the bedroom to the kitchen to the washroom. back to the living room. That is our work. That's not enough.
That's not enough. We
That-
have to work.
You have to do walking.
Yeah, and I think if we start our reading 5 times salah with sunnat, with
That is
nawafil,
very good.
I think that's also very, very good. If the people are not going out of the house, they are not well, they can read their full salahs with their sunnat muakkada, ghair muakkada, and nawafil. And what will happen? Then our body actually start working, and then we're getting close to Allah subhanahu wa ta'ala. This is my program with Dr. Akhtar, and I really appreciate that
Thank you.
have given us time. So you are busy with so many things, so many, as I mentioned, you have so many, appointments and meetings. But thank you so much that we are getting good information from you, and the people actually learn from you, like how to use and how to use those tablets as well. So inshallah, from today, no one is having tablet with the fizzy drink or the milk. We all having room temperature water, and keeping some kind of we can say, not indulging all the tablets every time. Even calcium we can take as well. Whatever doctor said, this is whatever the doctor prescribed, whatever tablets you are taking, but during
If you have a
some
test,
interval,
your
some
vitamin
interval.
D is low, your calcium is low, then you take it.
Yeah,
If the calcium is normal, you don't need to
You
take it.
don't
If
need
your iron is normal, you're not going to take iron. Your normal food is enough.
yeah.
Every food got all these minerals.
Inshallah, sometime in future we will take doctor for other supplements, with the food supplements, how we can make nice food to make us more energetic as well. बहुत इजाजत चाहते हैं. Assalamu
Thank you so
alaikum wa
much.
rahmatullahi wa
Waalaikum
barakatuhu. Inshallah, we'll meet you next week Monday from 1:30 till 2.
Radio Al Ansar, 24/7, 365.
Welcome to Simplex Radio. Visit our showroom for the